Hello, my name is Dr. Eugene Scharf, and I'm a neurologist with an interest in preventive brain health and cannabinoid physiology. Thank you for the opportunity to discuss our forthcoming article, Medical Cannabis, which will appear in the Mayo Clinic Proceedings. The key message of this article is that herbal cannabis is emerging as a viable therapeutic option in select clinical scenarios. However, demand for its use has outpaced the legislative, political, regulatory, and clinical evidence base supporting its use. Therefore, the clinician can provide a key role to patients in guiding the appropriate use of medical cannabis. This article provides a timely overview of these considerations. Herbal cannabis is currently illegal at the federal level. However, recognition of its therapeutic potential has resulted in political advocacy efforts that have resulted in a legal framework for its use at the state level. Thereafter, state-level cannabis dispensaries and cannabis programs have been created. Currently, in the United States, 31 states and the District of Columbia have medical cannabis programs. Patients interested in using medical cannabis can register with these state programs. Clinicians can certify patients that have conditions that require the use of medical cannabis. Clinical studies supporting the use of medical cannabis have the strongest evidence for its use in chronic pain, spasticity, cachexia, and as an antiemetic for nausea and vomiting from chemotherapy. However, urgent research is needed to learn whether medical cannabis is useful in other clinical scenarios. In a first, the medical cannabis derivative, the non-intoxicating cannabidiol, has received federal Food and Drug Administration approval for its use in 2 severe forms of childhood epilepsies. As a result of this federal ruling, the Drug Enforcement Agency has rescheduled cannabidiol from a Schedule I substance to a Schedule V substance. Cannabidiol is now available for use in these 2 clinical scenarios. Mayo Clinic investigators are currently engaged in prospective research efforts to understand the effects of medical cannabis on the state-level program recipients. Urgent research is needed, and a medical cannabis research agenda is necessary at this time. This article provides the clinician with a concise, practical, and actionable summary for how to approach patient inquiries regarding the appropriate use of medical cannabis. The use of medical cannabis is an exciting new therapeutic option in select clinical scenarios where prior therapies have not had the intended effect. It appears that the use of medical cannabis will continue to increase. Our roles as physicians is to first do no harm. Therefore, the highest priority is to establish the safety profile for the use of medical cannabis in a scientifically rigorous manner. Thereafter, our next responsibility is to identify the appropriate clinical scenarios for its use. A cannabis research agenda is necessary at this time. Thank you for the opportunity to present on our forthcoming article, Medical Cannabis. I do hope that you enjoy reading it. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.